Vice Chair Watson introduce a new member in the room as well to discuss this and take it away.
Thank you, Commissioner Hinkle. I'm really happy to see Joshua Posner here. He's the Director of Strategic Initiatives for the Mayor's Office. He's doing a lot of great work, and I thought it would be instructive for Joshua to kind of share what Denver County is doing in our response to the asylum seekers and the migrant crisis.
Yeah. Thank you so much, Councilman, and thank you all, Matt, for having me here again. One of our team members made a joke that crises seem to follow me everywhere because I last spoke to you about how's 1,000. So, you know, I do not bring these crises in, but always excited to work with a really amazing cohort in the city and county of Denver to work on addressing some of these issues. So right now, happy to speak with us a little bit about the way Denver is addressing newcomers as they're coming across our southern border, and we're getting folks from buses or just through their own travels into the city and county. You've undoubtedly heard about the financial crisis that this puts the city in. I can't really speak to all of the details in terms of what we're projecting out other than what the mayor's communicated publicly, but we'll be able to talk a little bit about our operations, our intake process, and some actually really innovative stuff we're doing today that I was just coming from, and sorry I was late. So since the migrant crisis began about a year ago, Denver has taken in about 40,000 newcomers. A lot of those come from the southern border, primarily via buses that are being sent by Governor Abbott, either from El Paso County or Brownsville. And that's really where we're seeing this major influx. We do have some folks that come through on their own, whether it's Greyhound through another city like San Diego, Kansas City, things like that, make their way to Denver by their own means. But the vast majority of folks that enter into the city as a newcomer, as an asylum seeker, come from those buses. We have seen various flows of them over the last few months. It's when you look at the data, you can see the waves pretty clearly that they ebb and flow. Right now, we're kind of in a lull period. We only have had 2 buses over the last week that we've accepted into our intake process. But earlier in January, we were sometimes accepting 11 buses a day. And so that range varies. Those buses typically have about 50 individuals on them. The most recent buses we've been seeing are about 36. We are able to somewhat anticipate how many buses are coming from Texas based on the information we're getting from FEMA and the border. And so the City of Denver's Office of Emergency Management has a direct line to FEMA where they start to understand what those numbers may start to look like in terms of folks crossing from the Mexico border into the United States. And we use that to a little bit project on what Governor Abbott may or may not do. There's not a collaboration there. There's not a discussion. We just get a notification that a bus is coming in about 8 hours, and we kind of react from there. Our team, Denver Human Services, acts as our intake center. And so if buses are dropped off during the day, we can set up intake operations at the web building. And then that's only between the hours of 8 a.m. and 4:30 p.m. Then if buses come after hours, they're directed to one of our shelters where those guests will stay for an evening and then be processed through intake. That intake process basically collects information about their name, where they're coming from, and asks for their A number, their alien registration number. It is actually a really key part to kind of what our ongoing process will look like. That number allows us to look into how they came into the country, whether or not they are straight asylum seekers or if they were paroled and given themselves up at the border. If they have that distinction, that latter distinction, it allows us to do some really interesting things in terms of work authorization. And we have the ability to potentially process their work authorization documentation and paperwork more quickly. I'll talk a little bit about some of the ways that we're actually currently in real time doing that right now. The fact is, though, the surge that we're seeing, and if the numbers and projections correlate throughout 2024 as they did in 2023, as Mayor Johnson indicated, Denver is going to be in a significant financial hole. And so we are really exploring ways that we can decrease our shelter capacity and responsibility through various potential partnerships, initiatives that we're working on internally at this point, but looking forward to sharing more as those projects get off the ground. One of the things we can communicate and are constantly sharing is that at the intake process is a really critical opportunity for our intake partners at DHS to communicate onward travel opportunities and really express to folks that Denver is a welcoming city. We're super excited to have you. It's also 32 degrees outside. We have very limited resources to continue supporting you. Our job market is and gaps are deteriorating. You know, the market share that these folks come in and supply from a work standpoint continues to be filled up by the 40,000 folks that came earlier. And so it's tougher for these folks to immediately find work specifically within the city and county of Denver. So we really encourage onward travel to other cities that may be interested in accepting of newcomers. So we're pushing that at this point, as well as looking at other creative ways to connect folks to potential resources in other cities. Going back quickly before I touch on the work authorization clinics, one of the reasons why Denver has become such a popular destination for Governor Abbott to send folks is economics. It's $80 for a bus ticket from El Paso to Denver. It's I think it's like $200 for an El Paso bus ticket to somewhere like San Diego or Los Angeles or other municipalities. So what we're seeing is Texas is making a financial decision and sending their folks to Denver. It's far cheaper for them to do that. And that's why Denver has found itself with the most newcomers per capita of any city in the United States since this crisis began. But what some of the things we're doing in Denver, yesterday we hosted the first work authorization clinic that the city is actually running. There are a number of other nonprofit providers and partners that have been doing this work for a little while. Denver and our team in the city and county specifically has also organized a clinic. So yesterday we saw 170 individuals who were CBP1 eligible and certified to process through work authorization. And that means filling out some paperwork, getting it authorized by an immigration attorney. But the real opportunity is that we were able to have USCIS, which is kind of the immigration arm of the federal branch, along with FEMA, who can help waive the work authorization fees and then perform biometric accounting of an individual. Both those pieces expedite the work authorization review process. And so in a process that may normally take a parolee or a CBP1 eligible candidate 2 months to get a work authorization from the federal government, by having USCIS on site as well as FEMA, we're able to shorten that process to 2 to 3 weeks. So folks are expecting to get their work authorizations that went through the clinic yesterday, potentially by the end of the month or early March, which is really exciting that we're able to put folks to work very quickly. So we ran one of those clinics yesterday. We saw about 170 folks. We're running another clinic today. We've checked in about 80 so far today. We're expecting that to hopefully get up to 170 as well. And then the city and county will be running a few more of these clinics through the end of February. The state will be running a couple of these as well as some other partners. So hopefully we're able to turn around work authorizations very quickly for folks. So whether or not they're in our shelters or out in the community looking to get formally work authorized, they'll have the legal means to do so, and certainly we'll be able to get folks into some much needed jobs as well. So that is kind of our high level recap of what we're doing in the city and county. Again, there are some other projects and iterations that we're looking at and exploring to, again, decrease these numbers and look at our policies. We need to brief council and go through all of those pieces before I think we're in a place to share all of that information here. But really excited to answer questions that folks may have.
Great, thank you, Joshua. We will go to online first. Was there anyone online that had any questions? I'm trying to see everyone. Commissioner Kraft Tharp.
Thank you. So hopefully you can hear me. If not, Andy Kirk can help you. So you said that you get a call 8 hours ahead of time that a bus is coming. Who calls you? Who is that?
Yeah, I believe it's the El Paso local municipality. They have an Office of Emergency Management as well, and they don't call us; they send us an email. And sometimes it's 4 hours after the bus departed. Sometimes it's 2 hours. Sometimes it's an hour before. So it's all really a guessing game. But El Paso will email us with the itinerary for their bus. We don't even get a roster or anything. They just say, this bus left at this time. It's got this many people on it, this number of individuals, this number of families. Have fun.
And they don't always send them to the places you want them to be sent to as
Yeah,
well.
we had some issues, and this is an interesting just reflection on the process as well. We had previously had issues where the bus would drop off in front of the Capitol or in front of the Web building at 11 p.m. at night, and that didn't work with the process. We were able to coordinate more with El Paso to be like, okay, like you're dropping off at these hours, you go to the Web building. If it's after hours, you're going to go to the shelter so these folks can rest and then get processed the next day. One of the ways communities were potentially exploring reducing the number of newcomers that were coming into their own cities was finding buses that would not follow that protocol and finding the bus companies directly, imposing taxes, even just if buses were arriving. Chicago experimented with this, for example. Denver, as a policy, we potentially explored that. Fortunately, Chicago is the guinea pig, and what they ended up finding were two detriments. One, the buses were going to come anyway. They were just going to drop them outside of Chicago. So these folks were dropped off at a suburb in Chicago with no intake process, with municipalities or communities that had no process to support them. And so they were just dropped off somewhere and didn't really have an opportunity to get directly connected to Chicago. And that was pretty messy. The other thing, Governor Abbott ended up just buying plane tickets for these folks, that it was still just as affordable for him to send folks via airline into Chicago as a bus. And so they were getting folks in Midway and O'Hare who had no way or understanding of the United States to get into the intake process. So we decided against that policy. We were just like, okay, let's just set these parameters so you can drop these folks off through our process as needed. So it didn't, it was an interesting experiment to potentially reduce the numbers of newcomers coming from those buses, but it didn't really seem to be successful policy-wise, and we didn't end up implementing something like that.
Thank you. Commissioner Thorpe, are you done?
Yes, I'll listen to other questions. Thank you.
Thank you. All right, Commissioner Loachman.
Thank you. Thanks for the presentation. I'm in Boulder County. We have been supporting with staff. Jocelyn Frankheiser, as one example, has been down in Denver for months and months, using her emergency management expertise and disaster response. We, as a board, just for awareness for the rest of MACC members, had a conversation earlier this week about how we might be able to support, and because economic stability is one of our new strategic priorities, the work authorization clinics is right in the line of what we believe is a way to help folks who are coming to this country to be able to work to provide for themselves and their families. So when I'm really pleased to hear this update in a little bit more detail in your presentation. My question I have two questions. One is, I also received an email from Andres Carrera this week, which thousands of people did, I'm sure, in regards to the ask for 500 volunteers to assist with this work. And just curious from the language access piece about how you ensure that you've got, are those certified translators, and how you're just managing that piece, because work authorization is also a really technical activity, and not just what I like to call bar Spanish. Some of you in the room might know what I'm talking about when I say bar Spanish. And so just asking about that piece, and also to know that USCIS and FEMA are both on the ground to move the process in a way that eliminates the cost when you talk about waiving fees. Just curious about how long that, if you can share what that commitment might be. So just I can hear some really creative ways about how to reduce this cost to make it more tangible for Denver, but just curious about how long we might be able, what you're thinking about how long that might be an option.
Yep. Great question. So number one, yeah, Andres Carrera is an outstanding volunteer recruiter. So if you have ever gotten an email from him, he is dogged and determined to get as many folks into these clinics as possible, and he's doing a great job with it. And yes, we're kind of vetting folks for a number of different operational stations for this work. So we do have interpreters who are right there with our lawyers, basically going through this work authorization paperwork with the migrant or the newcomer. And so they're really on the ground interacting and engaging with these folks pretty directly. There are some that we do need to kind of just translate documents and those pieces as well. So there is a good mix of kind of operational needs and technical needs that are applied in for those folks who are able to interpret or translate. And we also do have folks that are just kind of runners or gophers around the operation to just like help guide and support folks going to restrooms, looking for certain resources throughout the process. So I think we're like utilizing these folks to the highest degree that we can from a technical and operational standpoint. There's also, I mean, this is day number 2, so I think we're learning a lot. Today specifically, we're probably over volunteered for the number of folks that we're going to end up seeing. I'm not going to have any qualms about that, but want to be respectful of folks' time and really exploring the ways that we better operationalize that as we move forward. So really appreciate that question, Councilwoman. And then in terms of the federal support, that's kind of ongoing and open-ended. They've asked us to give them 3 weeks advance notice of when we are scheduling these clinics out. So the last one we're going to have scheduled is March the 5th that the city is running. After that, we're going to continue to evaluate what our options may be. There's a lot of good political will that the mayor has built in Washington with the Biden administration, especially after the border deal kind of collapsed, that we feel like we can expend some of that to get those resources into Denver and really push those folks as long as we kind of give them that advance notice. The limiting factor in terms of how frequently we will need them is really based on the number of newcomers that we're receiving that are eligible for these work authorization clinics. So we know that there are kind of 2 pathways, or 3 pathways technically, a newcomer can come through. It's this CBP1 process. Those are folks that are really immediately eligible for these work authorization clinics. There's the TPS folks, the temporary protective status individuals that Secretary Mayorkas is kind of getting tried about right now. So that decision and whether or not that might get extended for Venezuelans and over a longer period of time is yet to be determined. If they do kind of extend that temporary protective status for the Venezuelan folks, they will also fit into that quicker work authorization category. But what we're seeing is those numbers are far outweighed by the number of newcomers that we see that are not work authorized or that are not CBP1 eligible, that are not paroled, and therefore have to go through basically the asylum seeker process. That creates a far longer runway for work authorization. And so we have to better assess who is coming into Denver, who is staying in our shelters based on those different distinctions to understand how much more frequently and how long we really need these work authorization clinics. So I don't have a great clear answer for you, but those are the things that we're balancing and exploring.
Yeah, that's great. If I can just add a comment, because I think what I'm hearing, and I think it's a fabulous example, and I know there were folks at NACO that were having some of these conversations and advocating at a federal level what I believe is a bipartisan opportunity in regards to work authorization. What we continue to hear, and I say that as a Latina, as an immigrant in this country, what we continue to hear in our communities is these processes that are set up that take 20 to 30 years to move through the process in the United States to be able to work and provide for your family and come out of the shadows. And you're showing us in Denver a way to set up and get services and eliminate fees and bring people in who want to help to change a process that's a 2 to 3 month into it a 2 to 3 weeks. So I would just commend that. And I would also encourage us to really, like, how do we advocate with that? Like, how do we move something like that forward for all of the people that are really looking for options? So great that you've got all the different levels of support, and just want to appreciate that.
Yeah, thank you.
Great, thank you, Commissioner Loachman. Is there anyone else online? I'm not seeing I'm not seeing anyone. We have about 5 more minutes left. We are a little bit over time, but I think this is a very, very important topic affecting all of our metro cities and counties. Is there anyone in the room? Yeah.
Thank you for this opportunity. Hello, everybody. In terms of the statistical analysis of the type of immigrant, what's the demographic breakdown? And of that group, who are the most able to get immediate employment?
Yeah, all the folks that we're seeing, I think someone shared the statistic with me, 96% of the folks that we end up engaging with, who we call as newcomer or migrants, are folks originally from Venezuela. The other 4% seems to honestly be children who were born on these folks' journey from Venezuela to the southern border. Plenty of folks have had given birth in Colombia or Mexico, and so those
What's
children.
the gender breakdown?
I'm not sure the gender breakdown. We are seeing a good mix of single men, single mothers with children, and complete family units, and non-traditional family units. So you kind of see all shapes and sizes.
What about breakdown of skills?
Skills, so that's kind of transparently been a gap in our intake process. That our process was stood up as an emergency operation just to identify name, date of birth, identifying information. We're really working hard at collecting a lot of these skills. We know there's a wide variety. I mean, I've engaged with folks who are teachers in Venezuela, who are lawyers, who engaged in high education jobs and fled based on the circumstances there, and are just really excited to get themselves into any opportunity in the United States. So we're seeing all ranges of skills, and folks who are currently working without work authorization, who are just going out and doing some jobs, who are far more skilled than the work that they're doing, but looking to provide for their families. So we don't have that breakdown. I think in a few of the projects and new protocols that the city may be building, we're going to better be able to collect that information.
And also very quickly, one statistics that we don't really talk about are newcomers that got here that are pregnant. And we've had over 100 to less than 300 to this point, last update from Denver Health, of babies born from newcomers. So we have a whole group of folks that may not be counted in some of our statistics.
Yeah, and actually, Councilman, I'm glad you brought up children and newcomers through this process. One thing that's really interesting, or I'm finding very interesting about this process, is we are having children apply for work authorization at these clinics. And that's because a lot of the benefits that a child could receive through kind of that documentation process, we don't want them to be child laborers or go to work or anything like that, but they do receive certain benefits by applying for work authorization. So as you think about those things and find those processes, like any way we can ensure young people and children are getting authorized, getting documented is going to be a good thing, even though it seems kind of oxymoronic to have a child go through a work authorization clinic.
Yeah, in my nonprofit work, working with Afghans, Ukrainians, we know a lot of Haitians in the field as well. We've noticed that actually the kids get their work authorization first, and the parents are very angry.
Yeah.
But it is the part of the process of applying for work authorization for the entire family, because they do receive some benefits. Now, I will say to speak to two things, and I know a lot of our families have to go through biometrics, which is actually a pretty invasive process.
Mm-hmm.
So I would like for you to speak to that, because some people don't understand what biometrics does and what they have to do when they apply for that CPT-1 application. And then just sort of the funding aspect of it. So we just came back from DC. I just took an hour-and-a-half immigration course, and I have a lot more questions now than I have answers. But $8 million from FEMA is just not enough. So where are you guys at with that funding? And then if you could speak to the biometrics.
Yeah, I can't speak to a lot of the details of the invasive nature of the biometrics. I can tell you that in our operation, there's like a drape and pole situation. Like they do keep the area very private, and then FEMA's doing pictures and scans and all sorts of those things. So they do want to keep it private. If you are more familiar with
we do like eye scans. There's just a lot of scanning going on. And in our children, just so you know, I've been through like even blood draws. So they're doing a lot of sort of invasive.
I know we're not doing blood draws in the web building today,
but for that.
yeah.
But those who are seeking even green cards or
So it is, I mean, it is a very private process because it is kind of all of your personal information that they use to account and track you down. So, yeah, definitely an invasive process there. In terms of funding, this is one of the reasons why the city is exploring operationalizing this ourselves, because the costs are very low. The biggest costs that we're incurring at these clinics are paper and charter buses to transport folks. Everything else is being done through city staff or through volunteers, through volunteer attorneys, volunteers to help with interpretation, and then the federal support is coming without a charge as well.
Thank you.
But yeah, I mean, in terms of the FEMA reimbursement and those pieces, definitely not enough to fill some of the gaps that we're seeing from the
Yeah, it
supports.
was a little discouraging. Michelle?
I know we're short on time, and I want to acknowledge and respect the incredible compassion of my commissioner and council colleagues. I think that is really what is most beautiful to me, is that the heart to serve those in need it's really bipartisan, and it's truly, I think, a Denver Metro characteristic. I think where I pause is just the numbers. I mean, the magnitude is just, I want to make sure that I'm balancing compassion with this $180 million number.
Yep.
With, it sounds like, is it close to 35,000 that have come total?
40,000. We're,
No, 40,000.
yeah, I mean, I think my tracker's at 39,000. I mean, we'll surpass 40,000 by the end of this month.
So that's twice the size of Louisville. And just, I think, finding the appropriate way to balance. I love the work authorization option as a bipartisan solution. And I wonder, too, if there's any element of communications work, communications professionals in Texas to help educate people before they make decisions to get on to a bus. Nobody can be forced onto a bus to go anywhere.
I think the way Denver expresses and the Denver metro area is expressing that compassion in terms of having those conversations and seeing what folks are interested in is different than potentially that individual's experience in Texas when they board a bus. Our understanding is there's not a lot of direction given on those circumstances. Folks are told they're getting on a bus to go somewhere new, and that is really it. So there is some, we have explored partnership opportunities to communicate to folks about the potential difficulties of making a life in Colorado. In Texas, that doesn't seem to be our sustainable pathway out of this. We are exploring other partnership and conversations with other communities across the country that could be viable towards that. It does seem like at the end of the day, Denver is going to take in what we have to take in. Our opportunity is to understand how we reduce those numbers through creative means, whether that's work authorization or other partnerships. So that's kind of what the mayor's office is currently exploring from a policy standpoint. But I appreciate the question about Texas. I wish it was different. I think what we found over the last 18 months is it doesn't really look like that on the ground with them. And so we're finding our own ways.
Commissioner Lee, I'll be really quick because I know we're out of time. I would say that one of the things I appreciate about what Mayor Johnson is also doing, he's been on Univision. He speaks fluent Spanish. He has communicated very clearly to whether it's through Univision that Denver is a welcoming city, but we do not have the resources to maintain, and we're 30 degrees and cold, and there are places. So he's done that. We've had communications in Texas, organic communication directly to folks that are coming over the border that Denver is not the place for you to be coming to as well. And then the channels that Josh was talking about, trying to have discussions with folks in El Paso, which have been a little bit more welcoming than the actual state discussions. And so there's been a lot of real direct discussion, and in Spanish and across Univision that's spoken, that's televised throughout Central and South America. He's leveraged those opportunities, and I think folks know the message, but the cost of moving folks to Denver compared to Chicago, and also there's a political piece too. So,
And I think one, if I may say,
kudos to the mayor. And, I appreciate the accurate Spanish, Marta, being used in speaking of.
I don't think he does bar Spanish, but he does other Spanish.
school Spanish. I think one last thing to just wrap up in terms of that communication piece, and in terms of the different initiatives and programs Denver may explore, the way we communicate with these folks. Everyone is on WhatsApp, and communication spreads like wildfire across these groups. So as soon as you kind of communicate a new policy protocol situation to folks, yeah, people in Denver are already getting that to folks at the border and across our network.
And I'm
So,
getting WhatsApp updates as well.
yeah, so it is the 21st century of immigration. It's pretty amazing.
Yeah, thank you so much. Yeah, Mr. Posner, we have seen too, I've been some random text threads with people out of Denver, people actually going back to Mexico. And so we've actually seen people going back there because they have other better connections there. So there isn't a lot of talk about that. There also isn't a lot of talk of, hey, we're seeing about 10% of the Venezuelan population. We're not seeing like 100% of their population coming here. So we want to know and honor that with Colombia as well. One added aspect is that after going out to DC, and we really need to speak to our reps and our senators about working on that work authorization, because actually President Biden can do that. He can move work authorization forward, and we need to be speaking to our reps and our senators about that to say, hey, this is a problem, and make sure you can get other people to write them as well. Rep Escobar, Commissioner Stolzman met with her, and they are moving forward with what's called the Dignity Act. If you guys want to look that up on the internet, it just talks about a citizenship pathway, DACA. It also talks about tightening the border as well. And then removing the wait period for work authorization for asylum seekers. I believe that's in that bill as well. I need to look it up myself, but we just need to be advocates and letting our reps know that this is a major problem. So thank you for speaking.
Yeah.
We have 5 minutes left. Can you want to go for it?
Well,
thank you so much, Josh.
Yeah, thank you for having
Madam
me.
Chair, very much. Thank you. What I might do, and I know most people in the room are very intimate with the housing bills that have been introduced or plan to be introduced here real shortly. As we all know, there are three kind of key areas of legislation this year. The first is related to what they're calling strategic growth. There's an area associated with ADUs, and then an area associated with transit-oriented communities. The ADU bill is the one of the three areas that has been introduced, and that's House Bill 1152. It is it's pretty restrictive in regards to, we've had a lot of conversations with our local governments and our members with regards to, and one of the concerns that we all have, I think, is the usurping of local authority as it relates to any of these bills, right?
All have problems.
And yes, indeed. And the thing about the ADU bill, which I find puzzling, is that the majority of communities within this region have already instituted an ADU ordinance for the most part, including counties, right? But that bill, for those that don't know, is basically by right, communities shall allow ADUs anywhere where single-family housing is currently zoned. Also, there's a restriction, you cannot allow, I'm trying to say, there's a restriction on parking, so you can't make it a determinant that parking has to be associated with the dwelling unit. Does that make any sense?
Yeah.
Okay, all right. So that's that one. That's
I
the one
can
that,
understand it, everybody can understand.
there are some incentives with the bill, but I think, are pretty darn good for the most part. But again, Dr. Carr Board has taken a position on that bill, will next Wednesday. CML has taken a position of oppose unless amended to remove the preemptions that are in there. The other two have not been introduced to the strategic growth bill, and that is there are drafts of that. It's very close. It could even drop today. Senator Zenzinger and Senator Kirkmeyer on that bill. And this is the one I think that is most comforting, probably of the three areas, for at least I'll speak personally from Dr. Cox's staff perspective. It respects the planning process, and it respects doing plans, whether those be regional or local housing assessments, to truly understand what the housing problem is. We all know we need more units, right? But the question is the type of housing, where it should be located, and all those types of questions. So we're thankful for this bill. I think there will be broad support for this one. It does, so there's two components of that. There's a housing needs assessment that must be done, and then housing action plans. Each community or region is responsible for having to have an action plan and reporting on that every 5 years as to just kind of a tracking mechanism. The last I might mention is where there's probably the most heat, and that's the transit-oriented communities bill. A lot of work has been done on this, and I know Commissioner Odoricio, he's still on the line. He's been very intimate in this as well. So basically, what this bill does is that if your community has a rail station, a future bus rapid transit route, or frequent bus service within your community of 15-minute headways or less, then you are designated a transit-oriented community. And if you're a transit-oriented community, then you have to come up with a housing opportunity goal. So basically it's a land use exercise that around, I'll give you an example, so around a rail station, if so within a half-mile radius of that rail station, you had to have an average of 40 units per acre designated basically through your zoning ordinance to allow for that type, a minimum of that to allow. If you cannot or do not wish to comply with that, there will be, based on the draft bill, there will be restrictions to your highway users tax fund money, the HUTF. As you can imagine, that is not going over very well with local governments, and because quite frankly, there's a number of reasons for that. There's doesn't appear to be any nexus between HUTF and some arbitrary housing goal that we're having trouble understanding. Highway users, HUTF is basically used for maintenance and safety, right, of our existing roadway network, and so that's problematic. So there's that stick. There's also that bill hasn't dropped yet. Okay. So there's a draft that came out yesterday, a more recent draft that came out yesterday, which I'm happy to share with the group, Madam Chair, if they so desire to have that. We're expecting probably one more round of drafts on that bill, Councilman, but that's probably a couple weeks away before that gets introduced. But it's baked. That bill is baked. There is another provision in there that I want to make sure everybody understands, that if you don't comply with that housing opportunity goal, the state, and it's in there as may, request an injunction, basically forcing local government to comply with that goal. So it's toxic. I'm not going to lie to you. I'll be honest. I don't think there's a whole lot we could probably do in the House right now associated with this bill. I think for a hopeful that we can have, based on conversations that we've had, that there could be some room on the Senate side to try to get something, because I truly do believe, and I know Commissioner Odoricio feels similar to this, that there's a win-win opportunity for this TOC bill based on incentives, because the majority of communities that have rail stations or whatever have already done a significant amount of rezoning associated with those for high-density mixed use. And for whatever reason, those zones or areas are not developing the way they had hoped and anticipated. We believe that the appropriate conversation for us in the state to be having is helping figure out what the barriers are in those areas and getting those things moving. Let's start with that before you start some tabletop exercise of, arbitrarily designing land use. So
in Arapahoe County, we try to build them and then they get burnt out.
Yeah, well, I actually had a conversation with the Arapahoe County staff, and they're looking at, based on their tabletop exercise, they're looking at, 60-story towers in order to comply with this, right? I mean, you can zone for it, but who's asking the question whether you should have?
Or you can afford it.
Well, and the infrastructure investment that's required for that is just, I think it's being lost. It's the implementation part of this that's really causing us some concern too. But Madam Chair, I'll just leave it there. I could talk forever on this.
Yeah, I know.
So
We could actually add a whole other hour to this meeting, but I am not a meeting person that would last for, longer than an hour and a half, so.
Be careful what you ask for, because you may get it.
I know. And I know other commissioners need to hop off here. And I'm reading here in the chat here, but we do it really quick here. Chantel Lewis, Commissioner Lewis, you said there's been an RTD reform bill. I believe Rep. Linsett might be running that one. I'm not sure.
Yes, and Senator Winter.
Yeah, and Senator Winter, they're hoping that we can can discuss that here. We do have to keep the focus of, serving our unhoused, and I think that we can do that with, I think, that RTD bill as well, because they do rely a lot on our public transportation. And then, Steve, your question is does MACC have consensus that we should ask the Gov? Is that your word for governor? And TOC sponsors remove the, I like to call it the HTFU stick, but you like to call it the HUTF stick. We have not had any sort of consensus, but we could, it's hard because our next meeting is canceled next month. Do you want to speak to that, Steve?
What?
Yeah, I was just curious if we want to kind of do, can you guys hear me?
We can.
We can read you.
Can you all hear me? Okay, good. I'm on my way to the airport, and my apologies, I couldn't be there in person, but I mean, we could even just do a straw poll to find out if we have consensus enough on that one finite specific issue. We might be able to do just like a letter saying, hey, we look forward to working with you on all these things and finding a win-win, and but our focus would be to ask you not to use HUTF as a threat, given the fact that it's used for safety and maintenance. We believe there are other ways to accomplish this goal. If we don't have a full consensus, then I would withdraw the recommendation or offer. But if we have it, and it's, I bet Doug Rex could be able to take that letter, and we can all take that letter and throw it folks and just kind of give them some positive redirection off of that one piece. But again, I'm not advocating hard if we don't have consensus.
Okay. Denver County, we can't do a straw vote on anything that's going through legislatively. We have a legislative suite. So no matter how I personally feel on that, we wouldn't be able to participate in a straw vote.
We could do, Commissioner Odoricio, I'm wondering if we could reach out just to the different jurisdictions and what their view is on that anyway, because we do have that view with CCI, we belong to CCAT as well. If that is a consistent view that we're seeing, I don't see why it's already gone through those legislative processes. If Denver's already discussed that issue, if we could just see the pattern and we can just list the jurisdictions in the metro area, would you be amenable to that?
Yes, absolutely.
Yeah,
Absolutely.
We
I'm
would
happy
need
to
to check
talk
our
to
legislative teams.
offline about that.
Participate. Denver wouldn't be able to participate.
Yeah, we'll be able to check with Denver. We know, I think there's been many talks about this, and I believe that that's high on the priority of removing the HUTF stick and working on incentives. So, but if our voice can add to it, then I don't see why we can't do that if we see consensus. So, okay, thank you so much for today. Thank you for being here. And Chantel, Councilmember Lewis, I definitely see you there, and we'll bring it back to put on our agenda to look at that. So thank you. All right, see you all.
Thanks. See ya.
Me. Nice meeting you. I was like, you're scaring me with that bill. I was like, I haven't heard anything about that.
Just like it.
Oh.